Hello, good evening. Thank you very much, Lonnie. Thanks for staying and listening to a little bit more about this, because I'd like to shift the frame a little bit. We've been talking about our kids here and your kids and all the many things that they can and do need. Yesterday, I was downtown at the Youth Prevention Luncheon at which Michelle Obama and Mayor Emanuel spoke about, I think, the crisis that we all recognize is happening in our city in Chicago. And it doesn't take very much of an imagination to shift the frame a little bit from what our children need here in the environments that we are able to give them here and what children in far more stressful environments need. And as Lonnie mentioned, we at the Ounce have been focused for 30 years very much on children in poverty and in the many, many ways in which we can, along with our partners at Erickson Institute, at the University of Chicago, and many other great resources in Chicago and across the country, how we can begin to change the outcomes for children in poverty. We're doing that both by running programs and by doing policy and advocacy research in partnership with other institutions, and by building and demonstrating programs that we know can move the needle. And why is this so important? Well, this is actually J.D. Brooks-Gum and Professor Heckman. And this is a slide that I like to show a lot, because if you look here, this is a slide that shows actually the achievement gap broken out by maternal education, which we know is one of the biggest predictors of children's educational success. And the really interesting thing here is that there are four basically parallel lines that run from age 3 to age 18. And what researchers have found is that the achievement gap is well in place by age 3. In fact, if you're a savvy researcher, you can see it at 3 months, and it can be measured at 9 months. So thinking about the achievement gap or about dropout rates in high school or even in middle school is all of a sudden too late. It doesn't mean that any individual child can't see changes in their outcomes, but what we do know, it's telling us, is that from a societal point of view, systemically, we cannot close the achievement gap if we begin after children enter formal schooling. So this is a very famous piece of research that I'm dying to redo now in the age of the iPod. This was done in 1985 by Hart and Risley. It's a very, very important seminal study, although it happened really with a very small number of kids. And what they did was they actually mic'd these kids and went into their homes, and they actually listened to all the language that was going on in the home. And they went into homes of parents who had college degrees or beyond, parents who were high school graduates, and parents who were high school dropouts. And the scary thing about this is a slide that shows how children developed. We all know that children begin to have that big language explosion just around 16 months. But what's interesting is that the children from these different environments had massively different language explosions. And by age 3, they had enormous differences in how many words they knew. What they found is that children in some of these most advantaged homes, probably like your homes, were hearing a couple thousand words an hour, which is to say their parents never stopped talking, which is okay. But in contrast, the children in the least advantaged homes heard a fraction of that. And what happened over the period that they were studying, they found that children who were in these least advantaged homes had a 30 million word deficit, 30 million words. So it's no surprise that by the age of 3, the children of college-educated parents had vocabularies that were 4 times the size of the children in the least advantaged homes. And the trouble is that those vocabularies are predictive of 3rd grade reading scores, and they're predictive of high school dropout as well. Now, it's not just vocabulary, because it isn't about content. It's really about what's going on in those experiences and in those interactions. And this is a pretty scary slide, because what we've learned is that the children in those homes where very little speech is happening, and in fact, a lot of that speech is not actually positive and socially and supportive, but in fact, a lot of it is unhappy speech, it's angry speech, or in some cases, it's controlling behavior speech. Those children who are raised in environments that are not supportive, that are not responsive to their needs, that are sometimes chaotic, actually have biological changes in their brains. So all of the executive function skills that Kathy was talking about, all of the impulse control, but also all the higher order thinking, the planfulness, language, problem solving, critical thinking, all of that happens in our famous prefrontal cortexes, the things that we now know our children actually don't really have. As somebody said, they're not actually retarded, they're just adolescents. But in fact, what happens is children who live in highly stressful environments in the very, very first years of life, when brains are really being built from the bottom up, these children actually develop smaller prefrontal cortexes. There is actually less gray matter in those parts of their brain. And the problem is there are critical periods for brain development, and those children never catch up. A really terrifying set of research done in Berkeley with middle school students found that, again, now that we can put them all into these computers, into these scanners, and we can see their brains as they're operating, we can see that, in fact, they separated children into two categories, regardless of their current income. They actually controlled for their current income. They looked at their income in the first 5 years of life, and they used that to separate children into two groups. What they found were that children who were poor in the first 5 years of life had smaller working memories, slower processing speed, smaller prefrontal cortexes, and they described the performance differences between those children and children who were reared in middle-class environments in the first 5 years as being on the order of magnitude of having had a stroke. Now, what this is suggesting is these were middle school children. This was 10 years past the time that they were controlling for. And what they're finding is that those children, as they're developing, are actually held back by the development of their brains in the first 5 years of life. So, in fact, they're doing poorly because they were poor, and not because of something inherent in their capacities at the beginning of their lives. And we know that what goes on with language and with problem solving is going on with the important self-regulation skills that Kathy talked about. This is a similar set of characteristics to the 6 C's that Kathy presented, but it really speaks to the importance, as Kathy said, of entering kindergarten, not just with language skills or math skills or spatial skills, but with these very important social and emotional capabilities. And these are skills. It's not about knowledge. It's not about how much you know. It's what you know how to do. It's the capacities that you bring into kindergarten. These critical skills of curiosity, of self-direction, of persistence and motivation at tasks. These are the ways that children actually build their own human capital and their own capacity to learn. Because we know that, as Kathy said, it's not about pouring information into children. It's about helping children have the skills so that they can develop and develop those learning themselves. And of course, as we know, because we all know now that our children are going to have 35 different jobs throughout their lives, that they're going to have to continue to learn throughout their lives in order to be continually relevant. And these are the skills that teach them how to learn. The huge challenge we have is that the children in poverty are not able to develop these skills. And why is that? Because we actually know, again, from Adele Diamond's research and others, that the chaos and the stress that's caused in the environments in which many children in poverty are raised. These are the stressors that come with poverty, with not knowing whether you have enough food to make it through the week, with not knowing whether you have enough, having to decide between bus fare and medicine. These stressors, they make very, very cranky and distracted parents. I've always felt that of the many adverse experiences that I know I've exposed my children to, sometimes before breakfast, I know that it's nothing compared to the adverse experiences that families who are living in communities that are plagued by chronic violence, where they have themselves experienced trauma, and that those experiences, in fact, create both chaos and distraction and a disruption of the attachment relationship and the responsiveness that these parents want to give to their children. And they create environments in which children really are unable to develop those skills that we've just talked about. So why in those places, why are we so obsessed with early childhood education for children in poverty? Because we know, as Kathy said, the guided, supportive, We call it scaffolding in the literature, and that's really when teachers and adults help children discover by asking open-ended questions, by guiding them through experiences so that they can learn themselves. We know that this warmth and responsiveness, that these things actually mediate the stressors of poverty, and that in fact some of the natural outgrowths of being highly challenged and highly stressed and not having enough resources, attention, or emotional supports that lead to neglect and abuse actually negatively affect these long-term social and behavioral functionings. So my message really to you is fundamentally about ensuring that we think about all of the many opportunities that we are trying to find for our children in creating those effective learners, the children who are going to be able to learn and participate in the workforce, and recognize how essential and important they are for children in poverty. What we know more than anything else is that all children are born learning and born with the capacity to develop. We also know that brains are developed from the beginning through interactions with adults, through interactions with other children. And it's these critical skills of warmth and responsiveness that more than anything else will allow children to develop these skills. So a couple of takeaways I'd like to leave you with. First of all, we are very excited that President Obama, who learned a lot of what he learned from Chicago and from the advocacy efforts of many of us, has brought Preschool for All, a Chicago and Illinois creation, to the entire country, and that's the name of his new early childhood program. We're very proud of that. We know that what's critical about that is that it's actually a focus on quality. It's a focus on not just making sure that children are custodially cared for while their parents are off working, but actually that the teachers that will be helping those children develop will have the training and the knowledge and skills and the resources to give these poor children the kinds of exquisite classrooms and exquisite and finely attuned and very well-trained teachers that you have here at North Shore Country Day. That's really the most important thing from a public policy standpoint we can do. Create quality early learning experiences for young children and create programs where parents can be supported in doing the kind of dialogic reading, in doing the kind of responsive and playful kinds of experiences with children that we know will help them develop into the kinds of learners we need them to be.